Hi, my name is Linda Brewer, and I live in Hill City. And I just wanted to talk to you today about some of the things that have happened to me and some of the results that have come from some of the programs that are available in this state. In 1994, I became disabled with fibromyalgia. And I don't know if you know anything about that disease, but it's extremely painful and extremely disabling. And while I'm in a wheelchair most of the time, I still like to contribute. And after I got on disability, I got a part-time job with Link Incorporated. It's an independent living center. And I started out as a volunteer. And after I did that for some years, after the death of my husband, they hired me part-time. And I really enjoyed my work, and it has helped me understand the problem of funding and the problem of programs and the problem of trying to fit both things together, and actually from both sides, because I can see how the programs are supposed to work, and I can also see the problems of how they're supposed to be funded. I need the programs. I need the Medicaid. I'm on the Working Healthy program. I need the worker that I have, the caregiver, to come in and help me get ready for work in the morning. I need her to help me take a shower because I cannot wash my own hair or cut my own toenails. I don't think that's enough of a reason for me to go to a nursing home. There are lots of reasons to go to a nursing home. I don't think that those are enough reasons. I think there will be a time when I might need to do that, but I don't think that time is yet. Working Healthy has helped me maintain my own home, has helped me maintain my car. I drive. I have this wheelchair. There's a lift in the side of the van. I drive myself to work and to meetings. I travel around and see some of the consumers that I help care for, and I like my job. And I really hope that you don't cut the funding for Working Healthy or for Medicaid, because it's such a needed program. It is a supplement to my Medicare, because I had worked as a nurse's aide before I got disabled with fibromyalgia. And it was never my intention to stop working entirely, but I just figured God had a better idea. I always said that I didn't have enough time to pray, and God fixed it so that I did. And my back doesn't hurt quite as bad as it used to when I got done with the evening shift at the hospital. It really upsets me to think that the programs might go away, because Link provides such an array of services, advocacy, and before I got involved with Link, which is an independent living center, I was just sort of at the end of my rope. And someone here in town made the comment so that I could hear it. Well, she can walk. She doesn't need that chair. And I suppose to a certain extent that could be correct if you don't mind following me around and picking me up off the pavement. I fall quite a bit. I guess you can probably see that. I appreciate what Link does, because they help people get back in touch with their lives. They help them do paperwork and get in touch with the services that they need. And they know how to send people who understand needs to put their needs in touch with the right program. And if all the programs go away, then no needs are going to be met. And I'm here to tell you, there are plenty of needs out there. There are some really poor and really sick people who really need Medicaid. And I think Link has done a pretty good job of standing in the gap for those people, because I'm one of them. And I really love my job. And I like to work. I like dealing with people. I like taking care of people. I've always done that. I was a nurse's aide since I was 18 years old. But when I had to give it up, I thought my life was over. But this is just the next chapter. What I wish could happen, if I had a wish, is that you'd find a way to extend the Working Healthy program to the retirement age of the person instead of to just 65. Because I think my actual retirement age, even though I'm on disability, is going to be a little higher than 65. I think maybe it's going to be 67 or something. And it would be nice if I could stay on Working Healthy until then, because I really do need the attendant care, and it's really nice to be able to have the medication that I need because I feel better. I can contribute. I'm paying taxes. I go to work and I pay taxes in the community just like you do. And I've always contributed to the community, and I still am, even though I'm disabled. One day, when I was sitting at home, my friend called me, and she said, "Hi, this is Cheryl. I'm the new Link rep in Hill City." And she said, "Can I come and see you?" And I said, "Sure." And she got to my house, and she said, "What are you sitting in?" And I said, "Well, this is supposed to be my lift chair." And she said, "Well, it doesn't look much like a lift chair." And I said, "Well, I know, it's broken." And I was sitting on 4 pillows, and it was propped up against the wall. And she said, "Well, I guess I know what my first project is going to be, is getting you a chair that you can sit in." So she did make that her first project, and I did get a new lift chair. And I lived in that chair for about 5 years. I slept in it, ate in it, sat in it, thought in it, prayed in it. I did just about everything in that chair. And I didn't have a ramp out of my house. I was trapped. I had a scooter, but my husband had to take the scooter and set it out on the ground down our 4 steps in front of our house before I could use it. And I got a ramp, and then they remodeled our bathroom through the camp program at that time. And now, with a ramp to get in and out, and my bathroom done over, I can take myself to the bathroom, I can take myself to work, I can do just about everything except wash my hair and cut my toenails. And I really don't think I can go to the nursing home just on that reason. I just don't think that's enough of a reason. I have a couple of caregivers, and one that does transportation for me. She drives me if I have to go a longer distance than just locally. But I'm still driving myself where I need to go. And it's really nice being independent. And I don't think I would be independent if it wasn't for Link and for the service that came through their agency, and with all the people there that helped me get the things I needed. You know, just the support and the friendship and having this job, I got my self-respect back. Do you know how really important that is to somebody that's disabled? You know, when you get on disability, you have to be convinced that you can't do anything anymore. You have to go down so far that you can't do anything, because that's how you become disabled. And the disability examiner has to find you not capable of doing anything, basically. Well, I wanted to know what I could do. So, through Link and through their help, I picked myself up and decided to see what I could do. And we're down the road now quite a ways, and I'm still going. It's true, I ride in a wheelchair, but that's okay. I'm good as long as my batteries hold. And with the ramp in my car, and, you know, just getting to work in the morning, it feels really good to be able to do that for myself. And I like what I'm doing. I like my life. I like taking care of people, which I'm still doing, because I thought when I couldn't be a nurse's aide anymore, I thought I was done. And I'm not done. I've only just started. And I hope you will continue to help me as I'm walking along